Excited. I'm Stephanie Abbu. I am a member of the executive committee on the Academy of Neonatal Nursing, and I would love to be the first to congratulate you on being honored with the Lifetime Achievement Award in Neonatal Nursing. So, congratulations, Terry.
Well, thank you so very much. It's gone so fast, this career.
That's
Uh,
awesome. Well, for everyone, this is Terry Johnson, and we're going to spend some time together learning about her journey through neonatal nursing and how we have gotten here. So, Terry, if you would tell us how you got started in neonatal nursing or as a nurse.
I had no plans on being in nursing whatsoever. I had a uh, undergraduate degree in theology and religious education, which is what I did first. And unfortunately, I got that degree at a time when women were not allowed to preach or teach or do anything in the church. And there was a friend of mine who also was at school there, but she was an RN already, did cardiac. And she was at her room, was on the floor of our dorm. And we talked a lot about nursing, and she snuck me in to see some things. And I thought, I think I want to do that. So I took off, and after my baccalaureate degree, went back and got an associate degree, then got a baccalaureate degree in nursing, then a master's degree in nursing. And it has been the most wonderful career in the sense of there is so much to learn. There are such things to see. Um, there is always some new thing that we need to try and solve. I can't imagine anyone not wanting at this point to be a nurse. Yeah,
Where
that's
did
what
you
I did.
start your practice?
I started my practice in Tampa, Florida. I went to there and got my degree. Worked at both Tampa General Hospital, All Children's Hospital. All they put you that through obligatory amount of pain early on while you're in school, knowing that's not what I want to do at all. So I applied right after I got my degree. I applied to the University of Florida, and they had a fabulous program whereby they brought on nursing interns, and they would be assigned to someone within the hospital. It was a 6-month program. You were allowed to pick 3 clinical areas, 2 months in each one. You had weekly meetings, reviews, you had a buddy system, and I picked neonatal nursing because I read an article in the Tampa Tribune about a neonatal nurse at St. Joseph's Hospital. And so I saw that and I thought, yeah, and doggone it, got to spend some time with her. So then I did that. I'm sorry, I did actually labor and delivery first. And I was there about a week and thought, no, no. I saw a woman stand on a bed to leave, and it was like, nope, this is not me. Um, so I lived through that, knowing that on the other side of the door, literally, was the NICU space. Then went over into the NICU space, and I was convinced I'm done. I am done. I love it. This is it. Take me now, Jesus. Um, but I do my third rotation, which was peds ICU. And I had a lot of trouble in peds ICU. It just crushed my heart sometimes, what you see there. My colleagues there, and those of you who maybe went there and worked for a while yourself, the bravery it takes to be the nurse in that unit all the time. I don't know what the difference is between NICU and peds, but the stories are just sometimes so tragic and rough. So I got through that. They said, where do you want to work? I said, NICU. And I got that promotion that every NICU nurse waits for. Good. You could start working nights and weekends. And that's what happened. Mm, mm.
Well, it sounds like some things have not changed since
Nothing
you
at all.
started your career because we still congratulate new nurses in the same
Yeah, we
way.
do. But they're 12-hour shifts. We didn't have 12-hour shifts then. So it used to
Right.
rotate. Yeah.
Right, right,
Mm,
right, right. Yeah, that
mm,
definitely is a
mm,
newer positive and negative for
mm.
sure to having those shifts for sure.
Yeah.
Very cool. Very cool. And then while you were a neonatal nurse, you went back to become a nurse practitioner, a lactation consultant, and lots of other cool and groovy things.
Lots of other. I get bored real easy, so I like getting, and it's real impressive when the letters on the back of your name fall off your business card. I find that very empowering. No, I moved from the University of Florida, where I worked in their NICU, back to Tampa St. Pete, where I lived, and wound up at All Children's Hospital in St. Pete. Um, I only wanted to do NICU, and so they brought me in, of course, on the night shift a weekend, doing 12 hours. Um, and during that time, I had a very insightful nurse leading boss. She was the head of the unit. Her name is Mary Walters. And she said, we need to be having nurse practitioners in the neonatal intensive care unit. We don't have any. They were so new then, nobody quite knew what they were or what they did. But we had reached a point of increasing unit size and not enough folks who um, were able to step up into an advanced practice role. We didn't have as many interns as we needed. We didn't have any fellows. And so she decided we're going to have an educational program for neonatal nurse practitioners. Did the first one. I became the teacher of it, taught the curriculum. Another great neonatal nurse, Kathy Fabritas, taught all the embryology because I wasn't about to teach that stuff. That was wicked. And we pulled together, I think it was 12, sort of like disciples, which for me worked really well. Uh, Folks from all over the country came down here, found a place to live, did their program, went back and did their clinicals. I went back to all their hospitals and went through their clinical rotations with them. And the next group showed up, and the next group, and the next group. So I think it's about, I could be wrong, but 120, 130 NNPs went through that program. And that's what we did. Um, and then we decided we're not going to do the program anymore. And so it was sort of bye-bye. So I had been working on my master's at the University of Florida, driving back and forth. And for any of you out there that are doing that master's thing, where you're in a car driving, you're in your house studying, I know it feels like a slog, but it is so important for you to get it to allow you to know what the heck you know. You're smart. You can take care of these kids. You are a vital part of what the kind of care is that makes or break these babies. I just think it's so important. We embrace that. So I got my master's. My thesis was on uh, issues around necrotizing enterocolitis because I have always hated that disease. Hated it. These babies that were healthy, they were fine when I came on shift, and they died within 12 hours. So about necrotizing enterocolitis and feeding protocols. So that's what I did there. Um, I wound up because every nurse I know has a second job. They needed help over at Tampa General Hospital. So I went over and did. For those of you, I'm sorry, I I have I have a device in my airway from having a cardiac arrest on an airplane and being on a ventilator for so long. So this is not my sexy job call voice, but it's that's what it is. I did a foolish thing just then. Sorry, I had to turn my phone off. Um, so I when I started doing whatever there, they really didn't need any NPs, but Tampa General is a huge community inner city hospital, and there would be 100 deliveries a day. I had never seen anything like that. Every size, gestational age, type of birth, prenatal care, no prenatal care, whatever. It was one of the best things that I ever did in my career as an NNP in the neonatal unit. I saw so many things physically on the babies when you did their physicals that were variants that if you're an NNP and you saw it, you would immediately throw them in a basket, take them to the NICU, admit them. We'd have the $7,000 test labs done, and we'd have this done and that done. And then it'll all be some bright person will go, it's nothing. And so I find that one of the problems I wish for NNPs is they got a lot more time looking at healthy babies. It just it also sinks what you learned in the NNP program. This is something to worry about. This is A-okay. Did that. While I was at Children's, we decided we were going to do ECMO. So I went up to Michigan, to the University of Michigan, was trained in ECMO. I am so old, and that was so long ago. And Stephanie may have experienced something like this in her career. It was so new. They literally sent us home with Xerox papers on how to make the pump, because we didn't have the pump per se. So then we had to find out I knew how to make one, how to build it, how to run it. And I know that for many of you who are in the highest levels of technology, it all starts back there. It was just amazing. Because we did hearts there as well. So we did ECMO for a while. And the ECMO program went over more to Tampa General. And what happened in St. Pete was we saw much more with the cardiac population. I did that. I worked at All Children's for quite a while. I got burnt out. We all do sometimes. I wanted to do something different. I went down and I had the fabulous opportunity to have as my attending in developmental follow-up Dr. Stanley Graven and his wife. You can learn from two better people. I mean, the thought of how these kids do. And if you're working in the NICU, you have to consider that these babies go to places and live that you and I have never seen. We know nothing about it. What am I doing? Am I talking too much? Can I keep talking?
This is perfect. Please keep
Okay.
talking. As long as your cough drop keeps working, you keep talking.
I got another one in case I need them.
That's right.
It actually is my interest in what happens to these kids when they walk out the door happened in the ICU at All Children's. I was working on a Monday, doing a 12-hour shift. We had our public health nurses. Oh my God, get to know your public health nurses. They are such help. I forget what unit I was recently. Literally set up an office for the public health nurse in their NICU. She's there every day. Yeah. So she walked in, she scrubbed her hands, put on a gown, and she's doing this. And she goes sort of in a big voice, "Is Terry Johnson in this room?" And I'm thinking, yeah, I stuck my head out, looked around the warmer and stuff. She said, "Need to talk to you." And I said, okay. So I came over to the bedside, came down. She goes, "Were you here Friday on evenings?" I said, yes, I was. It was crazier than a hoot owl. We had no beds. These kids were coming in. Had to get kids out. She goes, "Did you discharge baby Rodriguez?" I did. I said, it was a rush job, but the nurse got the training in. The baby was on the monitor. We had got a contact where we could send them to get their follow-up care. I was so proud of everything I did to get that kid out. She said, at any point in time, I'll never forget that. That's exactly what she said. At any point in time, did you ever ask them, do they have access to electricity? And I said, no, because everybody has electricity. Not when you're a migrant worker living in a trailer. But the people in her migrant camp found enough extension cords to run an extension cord from a pole through around the trailers to where they were to put the monitor on. That family, not fluent in English, not scientifically trained, were smarter than the nurse was. And we have to remember that. We've got to ask those questions. I ask any parent I talk to now. They may have a multi-million-dollar home up in Chicago. Do you have electricity? Okay. I will live with this forever. But those things are so important that it's not the same world. That transition is a big leap. And if you ever get a chance, any of you, to spend some time down in developmental follow-up, go over there and see the miraculous stuff they do and find. So yeah. After that, I taught on my own for a while. I had a little business called Lodestar, worked for different people, did consulting to hospitals, blah, 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 blah. Did that for a while. And during that run in time, we had moved to Chicago because we wanted to adopt a baby who had been in Chicago's court system. So we moved up here, and I was working for Pediatrics Medical Group. I worked as a locum all over the country. I have 8. I'm throwing away my licenses this year, as I'm not going to renew them probably after this year. The different states I worked in, they would send me as a locum different place. And I love that. And some way or how, I bumped into people from Proactive Bioscience. They were doing the monitoring of their research around the exclusive human milk diet at Rush University. And I was connected with Mary Puchowski, all the folks down there, Terry Russell Johnson now, all of those kinds of things. And I wound up, when they did their study, that they needed someone to monitor some of the data. So I got involved in it that way. And then they asked me if I wanted to do a little bit more for them, do some teaching about neonatology to their just barely opening up research group, and to the process by which they make the exclusive human milk diet and implement it. And so I started doing some extra time over there doing things. And I worked at it quite a bit, actually, for a while, because I got to see so many NICUs and what they were doing. And then they went and offered me a job. And I thought, that might be fun for a while, because I've done lots of jobs. I don't feel like I have to do everything just one time. So I did. And what I did with them was go to units all over the place, see those babies, monitor the data, and teach for them. And it was quite wonderful. I went to teach for them for the National March of Dimes. Rolacta sponsored me for the state of New York's conference. And I got on a plane in Chicago at Sunday afternoon, got on the plane and went. And in the air, I started feeling very lightheaded, uncomfortable, having trouble breathing. I stood up, put my hands on the seat in front of me. The stewardess came down and said, "You have to have your seatbelt out because it's rough weather right now." And I said, "I can't breathe and I don't feel well." And I just died at that moment. I went down. I don't remember anything from that point. 3 doctors on the plane. We had an internal medicine person, we had a cardiologist, and we had a surgeon. They'd all been at the same conference in Chicago. I have to tell you, cardiology, great help. Internal medicine, great help. Surgeons are looking for someone to set up their stuff. They're like, what are we doing? I don't know what we're doing. They diverted to Buffalo, offloaded me. I was in an outlying hospital. They couldn't move me for 18 hours. I was in a coma for 18 days, in and out of a coma. I was there for 40 days after I had heart surgery. I was in rehab there because I couldn't talk because I'd been ventilated so long. Couldn't walk, couldn't see. I had damage to the cortical part of my brain that seized. So you really don't want an NMP, I guess, a lot of the times, who can't see what she's doing. And I struggled for a long time. They finally sent me home from Buffalo. I went to the big rehab center down in Chicago. I did 18 months of outpatient rehab to learn to talk again. I had my vocal cords built again because I couldn't speak. Um, and I kept fighting to come back. Uh, I know no NICU would pick me up at this point. And I asked for lactitude, and they're like, I think you've had enough. I think maybe, and I begged Scott Elster, I begged him. I said, I've got to see babies. I've got to learn stuff. I've got to know more than I know now. And they drug me out. And so I've been working for them ever since. And that's what I do. I work in the medical education department. I do teaching about everything I know about human milk, about necrotizing enterocolitis, about feeding, and best ways to manage babies through growth. So that's what I do with them now. I don't get in nurseries near enough. Anybody wants me to come, you call. We will make my boss let me come. Okay. I miss you all so much. I miss the NICU so much. The good thing is being in all of my professional groups and being close with the industry side as I can be. I still take care of babies. I still love babies. I still love trying to think of some new way all the time that we can do a better job in taking care of them. And it's been a wild, wonderful ride. So it's my story, and I'm sticking to it.
That's amazing. And it's amazing that through all of that, that you have been able to find another path to still have the impact that you have
Mm,
on neonatal nurses, on babies, on families, to be able to share what you've learned, your
mm,
passion for this work, and for that beast neck, like what you've been able to do, and the science that you bring to it. But one of the things that I've appreciated the most and the impact that you've had on my journey is the ability to make it so understandable. You're
mm,
covering, gut microbiome and all this really cool and groovy stuff, but you're sharing it in a way that it can actually be received,
mm,
and then we can go and apply it at the bedside.
mm,
Because just sharing it and then we do nothing with it, that so what piece, that
mm,
what's next piece,
mhm.
has certainly been one of the reasons that I have signed up for every possible talk that I could ever get myself to once
No,
I found out you were there.
you could hire me, and I would just be in your unit talking.
That'd be
That'd be,
awesome.
that would
That'd
be
be awesome.
wonderful. But
Currently have a candy jar. I will swap that out for a cough drop jar. I'm happy to do so. People will be fine.
they will be fine.
They will
Yeah,
be fine.
they will be
That's
fine.
right. That's right.
Yeah.
So, for all this teaching, all this sharing that you've done, what is when you look back and think, wow, that's like one of the biggest changes I can remember, or the biggest impact, one of sort of those wow moments in your career that you can think of?
I think watching the development of um, the technology, the pharmacology, and the nutrition. I think we've always known in the NICU, it's a pulmonary issue bringing you in, or it's a heart issue for the most part, or an anomaly. We know that. And I, and maybe you, I'm not sure of our ages. We're not going to share that. I'm not going to share weight, any of those things on this call. But to, I see children now who never would have survived in my first decades of working, literally decades. The hypoplastic left hearts, none of them survived. None of them survived. Now they're diagnosed before they go from delivery room through a door to surgery. We've got a plan, and we do that. It's been really interesting. We're working a lot with human milk about that for growth intolerance because they have such trouble with feeding. But that ability to see things, and the younger nurses today are seeing things that I'm not even not comprehending. They'll say it to me, and I'm like just scribbling it down here while I'm on camera. And the minute you get off this camera asking me a question, gotta go look it up. It's always something new. Um, I think it's been phenomenal, our technology. I mean, I we built an ECMO thing with pieces of Xerox paper that came from the University of Michigan. Nobody lets you do that anymore, unfortunately. You just miss it, but it worked. But what I'm finding is I've never thought about it before. Nursing in particular, because remember, nursing's at the bed all day, all night. They go nowhere. They're there. And they are responsible not just for that baby, but every piece of equipment that's around that baby. And then we sometimes forget to ask them when you're buying the new ventilator, when you're buying the new pump, what's your input on this? They've got all the insight with it. And they need to be at the table with all of us, no matter what we're doing. Therapeutics, medications, equipment, does it work? Not an afterthought that, oh, we did this for you, now you get to do it. I think that coming to the table is a rich, rich experience. Yeah.
I'm just so grateful for the Xerox paper and the willingness to go back and build it. I'm so grateful for the risk taking that
Yeah.
sort of without risk, there is no reward,
Yeah.
that trailblazers like you, innovators, that people were willing to do this really hard work and come at it with such a sense of curiosity and wonder. How can we do this differently? How
Yeah.
can we approach this? And the families that allowed us to be part of their journey and
Yeah.
try those innovations,
Yeah.
and hopefully provide them hope and the best possible outcome for their family that we could.
Yeah.
I try to share that with new nurses, that sense of responsibility and gratitude for the families and for those that have come before us. If you were in a space to be able to inspire new nurses today who are coming in with all that technology, they've not had to calculate their drips or do some of those other things, right? So they didn't have glass bottles for their IVs, right? Like if you could share with them as they approach neonatal nursing today as a new nurse, what advice would you give them to inspire them in their career?
I think the two words you used, you have to be thinking creatively and you have to be exploring. Work, work on no matter what it is, what they pay you. If it's not a lot of fun, if it doesn't crank your tractor, as they say, it won't be fun anymore. You'll be doing something else. You'll be switching in and out. But to find a domain, there is so much happening. Literally, what is it? Thousands of journals. It feels like on my walls back there that I won't let go of because I'm still trying to learn from them. My textbooks, my videos. You've got to be willing to get excited about something. Don't get excited about so and so is a grumpy person. Just don't. You're probably not going to change that. But can I get them excited about something? Why aren't we asking questions? If I could change what happens at the bedside, the number one thing I'd have happen every single day is the nurse would present the patient. The nurse would present the patient. You know everything going on. You took every order off. You made sure it was hung. You made sure it was right. You saw the results. We need to incorporate nursing at the level of leadership at that bedside with input because there's other things that happen that are difficult then. You saw something, but you didn't tell them because they never listened to me. It might be the most important thing that's going on at that bedside. Um, I like the collegiality that I see at the NNP level. We need to take that all the way down to the bed level because it's the NNP who gets told by the bedside nurse. But being the sister brotherhood of nursing, we listen and move forward. But making that communication process, that seeking to do the best practice, part of our everyday work, I think is some of it. Yeah. We didn't talk on rounds when I started. You know, And that just sort of stayed around for a long period of time.
Did you just hold the chart?
Yeah. God forbid they asked you a question, you'd be like, "Well, I'm going on break now. They're doing
Uh-huh.
rounds on my baby." Yeah.
Uh-huh.
Yeah.
And now there's nurse-led rounds and
Yeah. Yeah.
yeah, yeah, yeah.
Yeah.
That's
Yeah.
phenomenal. We've certainly come a long way, that's for sure.
We do. And to be creative, um, there's people did. I worked with them some too. All the developmental care products, stuff like that. Nurses invented most of those products, and they invented most of what we started with developmental care. Um, that we drive a very big, important part of care and management and outcome at the bedside by what we watch and see every day and find a better way to do. Um, I just think, yeah, it's remarkable what we bring to the table. Mm,
Agreed.
yeah.
Well, I have enjoyed the privilege of getting to spend time with you today. I look forward to spending time with you in person
All right.
when we have you on stage to hand you the award. I'm going to get a fangirl pic, that's for
Woo-hoo.
sure, which will be great.
Yeah.
So appreciative of, again, your willingness to come at this with curiosity, always wanting to learn more, but not being a gatekeeper of that knowledge, making sure that you disseminate that knowledge.
Mm,
And for that, all of us that
thank
are
you.
in neonatal nursing are forever grateful. I appreciate you so much.
Love you, sisterhood. Love you, brotherhood. Mm, mm.
Thank you.
All right.
Okay.